different products and services, and they, you know, what they have. Especially give us an update also on what's happening on the COVID crisis, and how they're preparing for it. I think many of our companies and our members are already operating in the new normal in some shape or form, but understandably, the government has been making a lot of changes here and there, and it's hard to implement. And normally, most of us are not given adequate time to prepare. Earlier in the conversation, we were talking about face shields that are required August 15, which is you know, basically tomorrow, and yet the implementing rules and regulations are still waiting for that. So, and it takes time to mobilize. You know, there are only so many face shields we can purchase, and shortages. And I think it's also the logistics and the preparations behind it that maybe, you know, we could use some advance notice, and it could help us implement. I think if there's one industry that I know complies maniacally on this whole thing, it's the BPO industry. We bend over backwards to try to comply as best we can, you know, in a lot of the things as an industry, because we know our industry is very important to the economy, and also for the different markets and cities that we operate. So I'd like to just get things started. Again, thank you for coming today's session. Grateful that we're all here to have this session this Friday. Also want to take the opportunity, and I don't know if many of you are not familiar, one of our Board of Trustees member, Mr. Raymond Ang, who's our corporate secretary, and also leads the capability development organization or committee of the association. He passed away a few weeks back. I don't know if you know that. So we've shared our condolences to the family of Raymond. He will be missed. He's always been the life of our parties and so forth. Every time we have an engagement activity, it's always Raymond who's always there for all of us. So I'd like to, you know, maybe take a moment of silence and do a little bit of prayer to thank Raymond, and you know, say a few words. You know, maybe a little prayer on each of you just for Raymond. We can do that, please. Okay, maybe on that note, I'd like to turn it over, and thank you very much again. I'll turn it over to Gail. Gail, you're on mute, Gail. We can't hear you. Yeah.
Okay, there you go. Can you hear me? Hello?
Hi, we can hear you, Gail.
We can hear
Okay.
you. Yeah.
Sorry. All right. Good afternoon, everyone, and welcome to the 12th virtual membership meeting with members and friends of HIMAP. Today, we will talk about healthcare benefits for the BPO industry in the new normal. This is by HIMAP and our event partner, Pacific Cross Philippines. So, investing in insurance during these uncertain times are the must-haves for you, your companies, and your employees. Some questions in everyone's minds right now would be, is COVID covered by my healthcare provider? What do I do if I need to see a doctor but I don't want to go out? Today we will have two guest speakers, Mr. Carl Evans R. Henry, MD of the Medical City, as well as Mr. John Christopher Clayanta, Director and AVP for Medical Sales Division of Pacific Cross Philippines, who will try to help out answer the questions that we have. We also have two esteemed panelists, Maria Teresa Cucueco, MD, Assistant Secretary of the Department of Labor and Employment, and Mr. Juan Paulo Araneta, Associate Director for Business Development at Pacific Cross Philippines. Our moderator for today will be Sarah Machenda Silva. I would also like to acknowledge everyone here today, the HIMAP Board of Trustees and Officers, our Secretariat, our friends from government, DTI Marketing Bureau Director Sanel Perlada, our partner association CCAP, PSIA, ACPI, and IBPAP. We also have NACP President, Mr. Michael Lim. We also have Ms. Maria Victoria Monsayak, the Senior Vice President of Pacific Cross. And of course, I would like to acknowledge your dear HIMAP members, partners, and friends for attending today's virtual membership meeting. Thank you. At this juncture, let me introduce to you our moderator, Ms. Sarah De Silva. Ms. Sarah Machan de Silva sits as Alorica's Asia's Chief of Staff, a role that spans 16 years of leading operations at Alorica. Her tutelage stretches to help oversee nearly 40,000 workforce, which continues to grow ceaselessly in all sites across the Philippines, from Metro Manila all the way up in Ilocos and traversing the southern city of Davao. Sarah also supports the region's other countries, Japan, China, and India. And of course, she's currently one of HIMAP's Board of Trustees. Good afternoon, Sarah.
Thank you, Gail. Thank you so much. All right, so I'll go ahead and start off with our speakers. I will be introducing Dr. Carl Evans Henson, and I'll go through his role and accomplishments with the best hopes of not mispronouncing too many things, as it seems to be a bit of a tongue twister. So Dr. Carl Evans is an internist. His other specialties include infectious disease, as well as infectious disease practice and innovations. Dr. Henson is currently the director of the Hospital Infection Control and Epidemiology Center. He also sits as the Medical Cities chairperson on Antimicrobial Stewardship Committee and acts as training officer for the Hospital Infectious Disease Fellowship Training Program. Apart from his medical career, Dr. Henson is in the academe as clinical associate professor from the Philippine General Hospital College of Medicine. Let's give Dr. Henson a warm welcome and a virtual wave. Dr. Henson, go ahead, take it away.
Hello, everyone. I'm still trying to figure out how my talk will fit into a general membership meeting, but I hope that the ideas that I'm presenting today will be of some help. May I have my first slide? All right. So our corporate people have asked me to talk about our experience with COVID-19 from the perspective of someone in the front lines. So I have also taken care of COVID-19 patients, but I look at it from two perspectives, as a frontliner, but also as someone who has directed the response of our hospital throughout the pandemic from the beginning. And this is in connection with my role as the director of the Infection Control Center. My next slide, please. I think by now we all know the story of COVID. It all really started by the end of December, where China reported some unusual cases of pneumonia. And very quickly they identified the virus sometime around January 7th. And then from there, I think we all know the story. There was a big outbreak in China, around 80,000 cases, and then it spread throughout the entire world. Right now, it's a true pandemic because it is present in all but I think two countries who may have like unreliable reporting systems, North Korea and somewhere in the Baltic areas. Next slide, please. And this is the situation all over the world. I know that we are very alarmed by our numbers in the Philippines, and we are getting maybe 4,000 to 6,000 cases a day. But really, when we look at how other countries are doing, maybe they're also not doing as well. The epicenter of the outbreak right now, or the pandemic right now, is in the Americas. So the United States and Brazil. Europe is at second place with around 3.5 million cases. And you see here the epidemic curve and how the pandemic has really spread throughout the world, with most of the cases being in the Americas. So the United States and South America right now. We belong to the Western Pacific region, which is that pink little blob there on the lower right-hand corner of the screen. Next slide. These are the numbers for the Philippines from a couple of days ago when I made these slides. So the for us, our experience with COVID, we started meeting about this in the hospital sometime January 20th. And then we thought that the wave that we experienced in late March, where we had a swamped emergency room, we thought that was the worst of it. But now we see that there are really more numbers, some beginning sometime around late May until the present. No? So we are in the second wave, and we are at around 120 to 130 cases. But the death toll actually has been not been as bad, 2,270 cases from the beginning of the pandemic, and the mortality rate really is quite low. However, having said that, if you have a relative who had died, then you know that the low mortality rate will really be meaningless for you. Next slide, please. So these are the challenges that we faced, and I really, I really see it as two specific or two distinct periods. The early part of the pandemic, which is around March and April, and then I have a slide of our challenges in July and August. So back in March, when the pandemic was really just starting in the Philippines, we had a lot of unknowns, and this was an unknown throughout the world. Nobody really knew a lot about the virus. Whether should we include diarrhea, should we include anosmia or the loss of taste or smell in symptom screening. We just knew that it was a respiratory virus. Um, you'd present with cough, etc. Nobody really knew at the time how long people were really sick and whether after they got better, were they still contagious? There was no clear treatment options. I remember back in March there was a lot of talk about avoiding steroids for treatment because it would they say that it would worsen the infectiousness of the patient, and we didn't know a lot about how to make sure that the virus didn't spread. So those unknowns really played a part in the stress of someone who is planning a response to the pandemic, but also in the actual frontliners in the emergency room. Add to that the fact that there was PPE shortage, and this was a global shortage because the whole world was caught unaware about the pandemic. So there was not enough PPEs being produced worldwide. So we had to deal with, knowing the numbers of our warehouse with almost zero N95 mask, and you don't really know where to get the next supply. Fortunately, we really didn't run out to zero, but it was a challenge back in March and April. There was also very limited testing capacity. At the time, our ITM was doing all the testing. The entire country was sending all their tests to that lab. And very slowly, the RITM started capacitating more laboratories, and Medical City is one of those that had been certified early on to do RT-PCR testing. There was also logistical issues with ECQ. The hospital had to provide for housing for a lot of our staff members, and we had to open up. So since there really weren't a lot of patients, we had to open up some rooms to house nurses and techs who did not have means to travel from their homes to the hospital. And that displacement is very jarring for someone who is already very scared about the patients or being infected from patients that they see on a daily basis. The pros from that period, it was somewhat easier to sort of triage patients because travel history played an important part when we took a history of the patient, because community transmission was not as widespread. So you ask about travel to China or some other country, and you sort of get a sense of the risk for COVID that way. ECQ, while it had its challenges, also was a positive because people stayed at home. And I think the early part of the ECQ really worked in really reducing our numbers. And because everything was new, it was a very challenging period. People were very cognizant of the lack of availability of food and PPEs. The donors were very, very generous to the frontline healthcare workers, and we enjoyed a lot of free lunches then, and donations of PPEs. Next slide, please. It's now a little different. The challenges that we face now are very different. We know a little bit more about the virus, how to treat it. We do have some effective therapies like remdesivir and dexamethasone, and we have a better handle on infection control. We also are still unsure about long-term protection, whether if once you develop the antibodies, we don't know how long it will last and whether it actually protects you 100%, right? The main challenge now, I think, is the sustained community transmission. So it's all over the community now, and that's how a lot of our healthcare workers get sick. They go back home, they get infected by someone in the house, and then they bring it to the hospital and they infect coworkers, and we would have to put them on quarantine, reducing the capacity of our frontline staff. So these are nurses, techs, administrative people. They are all affected in the same way as maybe the BPO industry or some administrative office will be affected by community transmission. Travel history also is much less relevant now, mainly because we're here for about 6 months now, and travel has ceased almost entirely. So nobody has gone anywhere significantly in the past couple of months. PPEs are somewhat still limited, and they are definitely very expensive. To compare, I have a colleague who, before Taal exploded, was able to buy a box of N95s for about 900 pesos. That's a box of 20 PPEs. And now it'll go for about 3,000 pesos per box. So that's how expensive it has been. And of course, the economic impact of the CQs, the community quarantines, has been very challenging for everyone. Even the hospital management has to deal with, the loss of patients, etc. We all need to survive, and it has been very difficult for everyone. The pros for this period: greater availability of tests and a rapid turnaround of tests. And I think this has impacted a lot on patient care because we are now able to quickly triage our patients out of the COVID units and get them to the regular floors. Next slide. There was some mention about discrimination by someone earlier from Iloilo. And that is true also for healthcare workers, even very early on in the pandemic. So some of our nurses had to put on civilian clothes on their way to the hospital because otherwise no one would bring them to Medical City because they're identified as a hospital worker. There are some apartment and condominium owners who asked these healthcare workers to leave because they were working in hospitals, and this was early in March. And then there was, of course, no public transportation at the time. But before public transportation was halted, there was still Grab and Angkas. Some of them weren't given rides, and the rides were canceled if they are seen as someone who works in a hospital. So discrimination is very, very real. And that was a unique challenge to healthcare workers. Also, of course, family issues. Should I go home to my family? If I don't go home to my family, where will I go home? There are some healthcare workers who had to rent a condominium nearby, and then someone got sick in that condominium unit, so that put them all at risk. So it was a pretty challenging time for us, especially those who did not have, their family with them in Manila. The families were in provinces. So they had a much more volatile issue of, housing. Next slide. Next slide, please. All right. So I've been asked to talk about critical lessons learned. I think preparation is key. Singapore, if you guys didn't know, back in the first SARS outbreak, they started preparing already for another pandemic, and that's how really they built their system of surveillance. They built a hospital just for this, etc. So they were very well prepared. In Medical City, we were not that prepared, but we had been doing training exercises for a similar event, for like an infectious outbreak like this. So I think it's important that moving forward, we need to be ready for an event like this, because I think it can happen again. Crisis leadership is also critically important, and we have been blessed in Medical City that we have very supportive management here, who put people first before anything else. No? So I know that we spent a lot on making sure that our healthcare workers are safe, that they are housed, and there was food, etc. Agility is essential. I had the response of the Medical City for COVID, and it's a multidisciplinary team. So, and you know, and I think we all know that multidisciplinary teams are often very cumbersome because there's a lot of players involved. But we need to be very agile and flexible when dealing with a pandemic like this. Rapid diagnostics, I think, holds the key to the future of healthcare. And I really, really believe this, because once you diagnose a disease quickly, then you can manage. It's really about picking up the cases very early. Mental health should never be ignored. We made sure that our healthcare workers got psychiatric support, um, whether they were just frontliners who were not sick or those who got sick and had to be quarantined. We put them together in a Viber group with our psychiatrists, and they had some one-on-one sessions with them if needed, etc. So we needed to be sure that they, because stress is real, and you know the worry about whether you get infected, are you going to infect your family, etc. And then I think we all agree that our national healthcare system desperately needs an upgrade. And this is something that we need to work on after all this is over. Regardless of your politics, it is a fact that our national healthcare system really desperately needs an upgrade. I think that's my last slide.
All right, thank you very much, Dr. Henson. I guess it's really different when we hear it directly from our frontliners and our healthcare workers, and what you're going through on a day-to-day basis, and what just the different challenges that you and the community of healthcare workers face over the last few months. So, and especially on your last slide there on the lessons learned, and a lot of that holds true in terms of crisis leadership, the testing, and the mental wellness. And I'm glad to hear that it's being talked about a lot more often. So again, thank you, Dr. Henson, not just for speaking today, but for what you do on a day-to-day basis along with your community. We're rooting for you, thinking about all of you, and we truly appreciate everything that you do for us.
And you're welcome, and thanks very much for the words.
All right. So we'll pivot a bit here. One of our guest panelists has an upcoming meeting, so I'd like to introduce her first to hear from her before we get into the next part of our presentation with Pacific Cross Philippines. So go ahead and do that. We have Maria Teresa Cucueco, who is the Assistant Secretary of DOLE. Prior to appointment as Executive Director, employment was with OSHC in various capacities, such as Occupational Health Officer from September 88 until December 89. Also, Senior Occupational Health Officer from December 89 to 98. Division Chief Health Control Division from September 98 until April 2009. And Deputy Executive Director, April 7, 2009. Dr. Cucueco has also obtained third level rank for Career Executive Service Officer from the Career Executive Service back in February 14, 2012. Before, we'd like to welcome Dr. Maria Teresa Cucueco. Thank you for your time today. Before you head out, What we have flashing on the screen right now are the supplemental guidelines or interim guidelines on the workplace prevention and control of COVID-19. We would like to hear a couple of words from you to kind of go through what this is about, and looking forward to what we gain from you today. Thank you.
Thank you very much for inviting the DOLE. HIMAP, we are very grateful. But before we continue, no, I hope we are not, please do not show anymore the supplemental guidelines. Those were the guidelines yesterday, which was, we hope that would be the final one. But up to this morning, we do listen to our stakeholders. We listen to people. We listen to everyone who will be affected. And that is why I asked actually your friends not to show it because it has changed. Many things there are not anymore in the final, but yes, the final has been signed. It has just been signed a few minutes ago by both the Secretary of Labor and the DTI Secretary. So these are the supplemental guidelines to the previous DTI DOLE interim guidelines for the prevention and control of COVID in the workplace. This is, no, I think this is going to be, of course, very valuable for you in the BPO industry. It is looking at healthcare, but it's also looking at your how to handle workers' health and safety in general for your sector. The issues rising from COVID, especially in the workplace, and this is becoming a chicken and egg issue, is that the workplaces now are being said to be where cases of COVID are rising, and the workers go home and then they start to bring in the infection to the community. But what is what we want to happen, really, of course, is to prevent the transmission in the best ways we can. And the workplace is really a good place to start, so that if our workers who are sick should not go to work and seek the appropriate medical care, and those who go to work remain healthy and not be infected. Generally, that is what we want. And if we look at the minimum public health, then this is where actually the guidelines of the DTI and DOLE came in the first time. And even in the supplement, we continue to promote that same strategies of the minimum public health standards. And we just went on to further elaborate and detail. So this is already the talk. Do not show the slides, please, because I have a disclaimer now. It's not the same. That is not the final copy that is going out, that has been signed. But again, on mental health, because we're looking at the major strategies of resilience, of health, mental health, we have provided the necessary hotlines that would be needed for industry, so that workers' mental health, all our mental health in the workplace can be addressed. This is a very big concern. People's anxieties and fears are very palpable, and they have to be addressed. Then we look at the next strategy on reducing transmission. Here we look at, of course, the major strategies of masks. It's going to be there. Physical distancing, we would still 1 meter, but increasing it further is better. Frequent disinfection, of course. And here, please do not take this for granted, especially for your workers. You'd say, yes, we wash our hands, but when the DOH ran a survey on our guidelines to the nationwide, we saw that they wash their hands like twice a day, before they entered work and before they left work. They even ignored the many sanitizers that are present. So it's a mindset and it's a culture that we want to develop, especially now. When we say it's frequent, because if you touch surfaces which can be contaminated and touch your face, that is a source of infection. We always think, yes, it's there, but the frequent disinfection. But when it comes to practice, we really see that so much has still to be advocated. And down a face shield. This was one of major issues we had to tackle, because the transport already required. And I hope you understand why we want, why it was required. It's not because, we are promoting a face shield industry. It's because the masks alone, if it's a medical grade mask, they say the protection is just like 65 to 70%. If you add the face shield, it will increase to 90+%. And with physical distancing, all the more, the risk is decreased and your protection is increased. So, but on face shields, of course, we ask them to use it when they're interacting with customers, with clients, or when talking with each other in addition to the mask. But if work would mean that your face shields should not be worn, understand that yes, the safety and health of the worker is still there. Because if you're alone in your workplace and you will not talk to anyone, then you can of course remove the face shield. If your work needs further visual acuity and you have to look like, we had these calls like from the garment sector, then remove the face shield. But once you go out and start interacting with your colleagues or clients, the face shield is mandatory. So let me share that with you. And then we say that signages are very important, and the advocacy programs like training, awareness, please do not take it for granted. Why has the workplace been targeted as now a source of infection in one area alone? And even in the BPO industry, we already see that. And even the DOH will tell us, numbers are increasing. And it's so hard to track them down because it seems like, and when this is a discussion that we had, in one industry, in one plant, more than 400 workers tested positive swab. And beside each other, because it was an export processing zone, there were more than 10 industries, 10 establishments there who had more than 10. There were even those in the hundreds who were positives. Then we found out, they take off their masks in the canteens. In the shuttle services, they take off their masks and they start to talk. Even those who smoke. That's why if you hear the National Task Force, Secretary Galvez, Secretary Año, who speaks so strongly against uh, uh, canteens, and it's because these are places where it's like a mass gathering and it's a free for all. And then there's also those in the lockers, those in common room areas. So again, the mindset has to be clear, and our system of looking after ourselves, and and this is of course highlighted in the new supplement. Then of course, we gave more details on the in canteens, of course. Of course, you will still use canteens. Canteens are open for dine-in. It used to be that it might own, it just will be for taking out food, but now it's now for dine. It will be, but then the other measures should also be present. And uh, there are others on managing cases, and I think these are what you have always wanted, how to what to do in case you have cases, isolation and referral, contact tracing, and the testing. And let me go straight to that. We're saying that yes, that if you want to do testing, but do it with RT-PCR. And if you're going to do targeted testing, of course, you should know why you want it done. You can do mass testing if you want, if you have the money, but okay. On costs, the PhilHealth and DOHDO 258-A has identified priority sector workers in the economy who can be tested regularly. And these are workers who have interactions with the public, like the tourist workers, like those in the restaurants, drivers, teachers, cashiers, in the service sector, and the PhilHealth will pay. But it is going to be a regularity like every 3 months, every 4 months. But it is a PhilHealth package, and they said they will be paying for this. But if you're not in the priority sector, you still want it done, go ahead. But what we are saying is please look at the RT-PCR, because that is what the DOH also is advocating for, and understand the limitations of test. And of course, when you do testing, then there should be the quarantine, the isolation, close contacts, the tracing, which should follow. And the role of the safety officer, the health personnel, the safety and health committee are highlighted in the new supplement, as well as notification and reporting. If you do have a case, you have a responsibility to report in two specific areas. First, the location of the workplace, report it to the local health office and the residence of the worker. These are two different, if this might be two different areas, but you have to report. And it might even be more because the residence of the worker might be a boarding house. If that is a boarding house, then report to the location of the boarding. But if he will then go home, he has that the report still has to go to the barangay health team in the uh, official residence or where the residence of that worker is. So that is a responsibility of the employer as well. Then disinfection and closure of buildings, it's more detailed here now so that you can understand why if you will close, it's for disinfection. That is true. And it can also be for extensive contact tracing and for other policies that you have. So that we leave that to you. And then on leaves and entitlements, we just say that the labor code issuances should be followed, of course. Then you can also have benefits from the SSS. This is for the private sector, and that's why this is where the DOLE and DTI's jurisdiction is coming in. So basically, this is now a more comprehensive document. This is where this is now signed. We will be it's going to be published, I think, in a little while. So you're the first ones who I am sharing with this on an official basis. And thank you for inviting us.
Thank you so much, Dr. Cucueco. First is for taking us through the safety at the workplace, mental health, the transmission prevention, and our responsibility as employers. So I agree, it's really ingraining the culture of prevention with the face masks, the face shields, the washing of hands, and putting the health and safety of our workers as a priority, and bringing that type of practice out while they're on the road, doing their errands as essentials, and what they do at home. So rest assured, we have not shared nor shown the older guidelines.
Please, yes, because it's different.
Yes, I know. So we'll wait on the more comprehensive supplement that you just mentioned.
Will. Yes, it will be in the DOLE and DTI website in a little while.
Okay, great. And then that's really going to help our members, and we'll absolutely support and implement and comply to the guidelines on workplace prevention and the control of COVID-19. So thank you so much for your time today.
Again, I really have to leave. I'm very sorry, but thank you for inviting us. And I hope you can continue to invite the DOLE and partner with you as we really face the challenge. And I know we will be able to overcome. We will overcome COVID-19, but it has to be with all our efforts working together. So we look forward to, again, working with you and partnering with you. Thank you very much.
Thank you, Secretary. Thank you so much. All right, so we'll head into our next speaker, who is Mr. John Christopher Calianta. He's the Director and AVP for Medical Sales Division at Pacific Cross Philippines. He's a sales and marketing leader with proven upward mobility and lateral exposures to cross-functional roles in the pharmaceutical and insurance industry. A graduate of agribusiness management and major in marketing in the University of Philippines last 2008. Welcome, John, and looking forward to hearing more about Pacific Cross.
Wow, thanks for that, Sarah. Thanks for that very nice introduction. I hope I'm sounding really good now. So I just want to really thank Dr. Cucueco and, of course, Doc Evans for those very informative lectures, I would say. Me, myself, I need to be disciplined enough in really washing hands. Sometimes I just use alcohols, alcohol sprays and such. But yeah, really, cases are really going high. So totally agree with Doc Evans as well that our healthcare need really an update. Yeah. So again, good afternoon, everyone, and happy Friday. Thank God it's Friday, right? Of course, most of us are looking forward to having a restful weekend. I heard from colleagues and friends that working from home feels heavier compared to the way we do things in the office. I don't know. Maybe my colleagues could share. All right. Bachi, are you controlling the slide? Yeah. So probably allow me to take 10 to 15 minutes of your time this afternoon to probably forget about those stuffs that run into your minds. Just relax and be able to observe the relevant takeaways, no, from the information that I'm gonna share about having the, yeah, that's correct, having the peace of mind. So yeah, let me share about investing in insurance and peace of mind for uncertain times. Pachi, this question. I've encountered this question so many thousand times, especially during our sales meetings with potential clients. Why is insurance important? Today, it's a lot easier for me to answer this question because I've been in this industry, this medical insurance industry, for almost 4 years now. Um, well, back in college, where, as mentioned earlier, I finished agribusiness management, major in marketing. We had several economic courses that tackled the importance of risks and that security is indeed a form of good investment. Or, according to some, it's really an ROI. But my 4 years in the university may not be enough to make me appreciate the real essence of insurance or medical insurance. After graduating in 2000, was it 2000? Yeah, 2008, I immediately joined a multinational pharmaceutical company where I started as a medical representative, promoting medicines to doctors. Years after, rotated to marketing, then program management, including operations, to name a few. But none of those roles really taught me the value of insurance, particularly this medical insurance. Well, how would I? We are in the business of selling medicines, right? And convincing doctors like you, Dr. Henson, to prescribe our brands each time they see ill patients in their clinics. I've spent almost a decade in the pharmaceutical landscape, and really never was a time that I asked myself, okay, we are promoting these brands to the doctor, so patients will buy or can buy. But who's gonna spend for it? I mean, my assumption during those times that a patient can always buy out of their own pocket. Well, maybe like probably some of you guys, you are most of you are in the BPO industry, and who would have thought that one would need a medical insurance to pay for your medical bills if you get hospitalized or as simple as medication needs, right? Who would have thought? If I ask probably some of the guys now, you would just say, well, well, it's an HR thing, and we do have a card for that. True? Maybe you would agree with me. My mind was wired the same as yours years ago. So maybe, guys, the question is, John, if you're gonna ask me, of course, you learned about the value of medical insurance back in 2017, where you joined Pacific Cross Insurance Philippines, right? Well, absolutely wrong. Ironically, I've been running two business units for more than a year without even understanding the real essence of medical insurance. I'm not. I'm not kidding, guys. It took a while before it sinks in. So here it goes. It last or when was that? Mid of 2018. My sister-in-law was diagnosed with breast cancer stage 3B, if I'm not mistaken. And yeah, she doesn't have any medical insurance. Why? She's an OB gynecologist, and my assumption is that majority of doctors, I don't know if you would agree with me, Dr. Fenton, believe that doctors are on top of their health. And in case something happens, doctors can manage it or they can just manage it. Oh, yeah. Of course, they've been managing other people. How come they can't even treat themselves, right? But not in her case. So, long story short, she needed to undergo a, what do you call that, a mastectomy, removal of the breast, after which she should undergo chemotherapy, then several sessions of radiation, including vaccination, which would cost around 100,000 per session or per shot. I'm not really sure about it. But few months after, another nodule was found in her other breast, and doctors advised her to remove that one as well. And again, need to undergo all the therapies and medication that she went through during the first half. I mean, the removal of the first breast or the left breast. And not to mention the number of supplements that she needed to take just to make sure her body will be strong enough to counter the effects of the chemo drug. So it really expenses really skyrocketed, I would say, during that time, and all her savings in the bank and other investments have gone. And she even had to borrow money from relatives and friends. Um, so if I'm not mistaken, value would roughly be close to 3 million gone in one semester. So guys, this was the only time I learned about the true value of medical insurance. Unfortunately, my sister-in-law is part of the 84%. Bachi, I think we can go to the next slide. So she's part of the 84% of the population who are not financially prepared in case of sudden medical expenses. Only 16% of Filipinos are capable of spending during health crisis. However, only 8% of this 16% are only covered because, like you guys, their company provides such as HMO coverage as part of their employment benefits. So, next slide, please. Yeah, so insurance or medical insurance is not just about expenses or additional item to waste your money into. It prevents you from spending more. A lot of members or even clients are happy about their supplements being covered. Of course, if it is medically necessary. People nowadays are into herbal medicines and nutritionals to make their bodies healthy and avoid getting sick. People are becoming health conscious today. They watch their diet, getting aware of the supplements that they need to take, and of course, visit their doctors more often, undergoing laboratory procedures, again, with the objective of not being hospitalized. We all know that inpatients costs are bigger. So yeah, that's true. Insurance is about saving since you can check your health status on a regular basis. It will prevent you from spending more, allowing you to use your resources to other things such as food, clothing, etc. Next, insurance is, yeah, correct. That's for everyone. My younger self would always believe that insurance is for older ones because they are the only ones prone to diseases. Well, not anymore. We all know that we have shorter lifespan now compared to our great grandparents, especially in the working class. Young professionals like you guys, we are expected or we are exposed to so many stresses, as what Doc Henson mentioned a while ago, in the workplace that affect health. So everyone should have a medical coverage regardless of age, class, and role in the society. And this is my favorite, peace of mind. So remember my story about my sister-in-law? Well, it runs in their family as other relatives have cancer too. So yeah, I'm really making sure that my wife gets regular checks and taking many supplements as possible to counter the hereditary effects of cancer. Since she is covered by Pacific Cross, well, knock on wood, I'm assured that I don't need to worry about our financials in case she would need it in the future. I have the peace of mind that there is Pacific Cross who will take charge and take good care of her health and, of course, the welfare of our family members. Lastly, yeah, so that's correct. Having a medical insurance is also protecting the ones we loved or the people that we value the most. Let us not give them the burden in the future that they will worry about our health, our financials, and of course, our lives. So yeah, that's our tagline or vision or direction in Pacific Cross. We always tell our current and future members that we are indeed here for you. So let me give you a brief background of who we are, Pacific Cross. Bachi, our head office, our main office is along Makati Avenue. I'm sure you're very much familiar to that. But our sales force is housed in our Rockwell office, just in front of the power plant mall. Most walk-in clients are being entertained in the area since it is conducive to malls, resto, and clinics. We have 70 years of experience in the industry. I wasn't even born yet when the company started. And we are the market specialist when it comes to, that's correct, medical, travel, HMO, and accident insurance. Major business of Pacific Cross is on medical insurance, which comprise nearly about 75% of our operations. We operate mainly, by the way, on markets A, B, C1, that's included. And we offer dollar, peso, and euro plans for individual and group accounts, or mostly termed as HMOs, or healthcare maintenance organizations. Difference of HMO with that of our insurance business is on the maximum benefit limit or the allowable claim when one gets hospitalized. A regular HMO, just to share, would provide an NBL or the maximum limit of 300,000 to probably as high as to 500,000 pesos, while our insurance products can give as much as 100 million pesos coverage. As we all know, medical bills are really shooting up, especially these days. So the MBL of 500,000 won't take anyone or any farther. So next, we are part of the Pacific Group of companies in Thailand, Indonesia, and Vietnam. Bashi, what's my next slide? Yeah, we are in the business of paying claims. We are part of the Pacific Cross group of companies with sister companies in Thailand. I think I mentioned that a while ago. And we are one of the most financially stable insurance companies. Yeah, that's correct. I'm seeing the correct slide now. That's the reason why our president made mention of us in one of his speeches. In 2019, as you can see in the slide, we placed second out of the 57 non-life insurance companies with 3 billion in net premiums. Same year, based on insurance commissions ranking, we were at top 5. Last 2018 and 2019, we ranked first among the non-life companies in the ASEAN Corporate Governance Scorecard, or the ACGS. Indeed, we are in the business of paying claims. So let me share with you some more information about our claims. Pachi, can you show the claim? Yeah, okay. Yeah, a lot of information there, right? So as you can see, majority of our claimants were women, comprising of about 56%, while the rest were men. On the average age of our claimants is 41 years old, and they're enrolled with us for almost a year. That's on the average. With regard to the distribution of claims, 70% belong to inpatient, since the patient market or the Philippine market, I would say, is yet to adapt to leaning towards preventive management approach. Outpatient, on the other hand, would involve annual physical examinations, laboratory procedures, and the like. So here, out of the 48,101 claims filed in 2019, 91% of medical claims were paid, while almost all travel claims have been paid by Pacific Cross. So some more information about claims. Batch, next slide, please. As mentioned earlier, APE, or the annual physical examinations, are probably the most common and frequently filed claims in 2019. And I think this is very much applicable in the industry of BPO sector, since many of you are availing of this company benefit, and we encounter a lot of APE requests from our corporate account, especially during Q3 and Q4, because people wanted to check their health conditions before the seasons of festive comes in, right? The holiday seasons. So highest paid claim last year was related to women's illness on breast, while based on benefit, we paid the highest on surgeon's fee. Yeah, that's right. It's really the surgical procedure that's very, really expensive. And usually we receive majority of our travel claims related to flight delays. I'm sure you guys are into travel as well, and we are all excited to once again visit different places once the quarantine is lifted. So how did we respond to our clients during times of need? Slide, please. True to our promise to find ways to best serve our clients during the times of need. This is very interesting. I have our COVID-19 data, but this is as of August 3. Total number of admitted members were 122. It's not in the slide. I just have this in my notes. The total amount of claims filed, by the way, and paid for medical alone was 15.8 million. While for travel, claims filed and paid was 7.9. Hence, the total amount of claims that we paid just for C19 was 23.7 million, and what was just as of August 3. Pacific Cross is indeed superseding our standard exclusion on pandemic, and we continue to provide coverage for COVID-19. Let me just share, today, Pacific Cross has a total of 700 enrolled corporate clients with close to 22,000 members. And this is just for HMO business. The next slide, I think you can very much relate to. In the interest of everyone's health and safety, we encourage non-contact communication. People nowadays are afraid of going out, and how much more queuing in hospitals and clinics, right? We support digital initiatives, and we are with you in providing access right through your fingertips. So we recently launched two digital applications, which are accessible via web browser and downloadable from, is it Google Play and App Store? Yeah, Google Play and App Store. We partnered with 24/7 telehealth services of Kitika, wherein our eligible members can avail free virtual outpatient consultations, treatment plans, e-prescriptions, and medical certifications. For more info, you guys can just visit their official website at www.kitika.com. Another one on my favorite, I would say, is our plan, our homegrown SASI plan. Um, so really, this plan, this SASI plan, or I would say, I'm sorry, I cannot see the slide. Pachi, can you? I think the internet is freaking out again. Yeah, there it goes. Stands for Simplified Availment of Services and Settlement Interface. This enables eligible members to immediately reimburse 10,000 pesos and below outpatient availments credited to one's nominated bank account the same day. Also found within the app is the chat box, 24/7 emergency assistance. You know, guys, I'm a super fan of supplements, and it feels good to have the peace of mind having as many as possible. So each time I'm availing, I just want to share, each time I'm availing those supplements from different stores and networking companies, together with the prescription from my doctor, I simply attached a photo of the receipt and prescription in this app. And then, boom, in the afternoon, I'm going to be credited or in my nominated bank account. Filing, by the way, takes less than 2 minutes. So these are just some of the new initiatives that we have developed to cater to the ever-changing needs of our members. Digital contactless touchpoints that provide ease of access and better experience from our members. So yeah, I think that's it. I think I have the last slide, which contain some contact details. Can you flash it on, Bachi? Yeah. So yeah, correct. To date, all client-facing services are suspended until further notice. But we remain here for you by working from home. So for any medical needs, everyone may just reach us via the contact details as shown in your screen. And to know more about our products, of course, just visit our website, www.pacificross.com. .ph. So thanks for having me. Back to you, Sarah.
Thank you so much. All right. So we actually have our Q&A portion in just a bit, but before that, I would actually like to welcome our DTI Export Marketing Bureau Director, Senan Perlada. So thank you for joining our info session today. Okay, so into the next portion, which is the Q&A, we have a guest panelist joining Dr. Henson and Mr. John Calianta as an addition to our panel. So Mr. Juan Paulo Araneta is the Associate Director, Business Development at Pacific Cross Philippines. So he has 10 years experience in sales and business development for various industries, including 4 years with Pacific Cross handling various sales channel assignments. A graduate of the ADMU with a master's degree from Durham Business School in England. So welcome, Mr. Juan Paulo Araneta.
Thank you, Sarah. If I can quickly recap all the discussion points that Dr. Henson and John was able to discuss with us and our Assistant Secretary, Ms. Tess Cucueco. So on medical insurance and healthcare, in 2019, Pacific Cross paid claims worth 400 million pesos. These are the claims of all those who trusted us to really protect them. No? And Pacific Cross is one with our network, like the Medical City, wherein we want to protect you as one. No? So we want to address the unsureness or the uncertainty about long-term protection that was mentioned by Dr. Carl, as well as the high cost of treatment. No? So we want you to be prepared. We want you to have that financial foresight, and that is key. No? And on COVID-19, Pacific Law superseded our standard policy exclusion, no? Wherein usually pandemics are excluded, but for our medical plans, we cover COVID-19. No? And as of early August, the number of cases for COVID-19 that we have covered is over 100. And the total medical and travel claims that we have paid is about 22, 23 million already, wherein the highest individual claim that we have paid is more than 2 million pesos. No? And also, I want to mention that on digital initiatives, we wanted to focus on client engagement really and service delivery to adapt to the new normal or to the better normal. No? We have four items. So one is telemedicine. Why did we really rush to make telemedicine available to all our policyholders? I'd like to mention that in the Philippines, the doctor to patient ratio is 1 to 33,000 versus the global standard or the global ratio of 1 is to 6,000 plus. In the Philippines, hospital bed to Filipino ratio is 1 is to 600, ranging 600 to 4,000 depending on the area. No? So in the NCR, it's at around 600. No? So telemedicine is available via website, mobile app, so it can give you medical consults, a treatment plan, e-prescription, MedCert. And apart from those, we have launched our personal concierge services and as well as home healthcare services. No, what we really wanted to do is to make the claims and availment experience of our clients as easy as possible, adjusting with what's happening in the environment. And we wanted to make sure that our communication channels to our clients are always there, no? Whether it's via social media or official channels like our dedicated customer service number and our email. No? Of course, our partnership with our provider network, we always do case reviews, no, to improve the coordination and the ultimate service delivery to the common patient. No? And our concierge services are always aligned. No? And lastly, John mentioned SASI. So SASI is our homegrown mobile application where using a mobile phone, you can just attach your official receipt as well as your medical diagnosis or your prescription. You file it. If you bought prescribed medicines worth 2,000 pesos, you get paid within the same day. So we want that claims experience as easy and as friendly and as accessible as possible for our insureds. No? And lastly, if I can add, no, what Assistant Secretary Tess mentioned, the new supplemental guidelines focuses on 3 items: resilience, reduction, and the importance of the RT-PCR test. Basically, what they're saying is we have to adapt our mindset to the new normal, and let us all be reminded that there is a clear case management process in place that the government and the private sector will have to partner on. So making sure that the workplace and the residence of the worker is always reported in case there is an incident that happened. So I hope I was able to recap quickly the main points that our speakers have shared with us today.
Thank you so much, Dr. Araneta. All right, so this takes us into our Q&A portion. And we welcome questions via our chat here, and any of the folks that want to speak during the call also to ask questions or to provide their own input while we actually go through our Q&A. So I'll go with a couple of questions, which I'll point towards Mr. Calyanta and Mr. Araneta when it comes to medical insurance or healthcare insurance. So how do you feel, our us as employers can create more awareness around medical insurance coverage?
That's a very nice question, Sarah. We encounter a lot of that almost every day as clients would ask. But really, it's about conducting these events, awareness campaigns, not just through online platform, but every time we do engage our clients or corporate accounts, we make sure that they are really aware that having a medical insurance is something that they should not delay. It's to us in our lingo, it's actually a crime because you're preventing yourself from having the peace of mind, as I mentioned a while ago. So I think having these in the pharmaceutical, we have these continuous medical educations. So I think also we are into that. Our marketing partners are also engaged in so many activities that would provide awareness or increase awareness to most of our clients and future clients. Do you may want to add something, Pao?
Yeah, I'll add to that. Sarah, I used to also work in the BPO sector, and it would be good to give guidance that something as basic as asking your HR for a copy of your schedule of benefits and really reading through the benefits that are made available to you. Maximizing if ever you have mental health coverage, maximizing any embedded wellness programs. Ask your HR, and if your HR may not be keen to the policy, go and contact your provider. They'll be able to give you guidance and the primer for your top level benefits.
All right, great. Thank you. Thank you so much for that information. I do have a couple of follow-up questions to that. HIMAP is a mix of many different organizations. We also have the small and medium as part of our membership. So are there more affordable HMO packages that the SMEs can actually look forward to? And what kind of plans do you have that cater specific to BPOs that differentiate you from what other HMOs actually offer?
Yeah, sorry about that. I'm on mute again. Yeah, you mentioned about catering to the SMEs, and we in Pacific Cross, we always have these flexible plans. We always cater to the needs of our client. So, in fact, um, we tailor fit our approach when it comes to the client's need. Talking about the small to medium enterprise, even a group of 20 and below, we are now catering it. Gone are those days that we are just looking for corporate or huge accounts. But of course, it's in an ever-changing market. And to your question, Sarah, people can just go to our website, contact our sales agents really to know more about these products. But yeah, everything is available in our product portfolio, and we normally do tailor fit approach in these corporate clients.
Just to add to that, Sarah, for those HMOs that are interested, BPO companies that are interested, we can take over your current HMO provider. And we also have box plans, no, for accounts of 10 to 20, 20 to 50, or 50 up to 1,000. No? You can even do third-party administered services for those accounts with a large number of headcount. That's a third-party administered plan. So our proposal is very flexible, depending really on your requirement and your budget.
Okay, and I see that on the chat, you've also posted the information there, so for everybody to see. So thank you for that. Roger actually did have a question. Does Pacific Cross have medical plans that include the COVID-19 vaccine?
COVID-19 vaccine. Okay. Well, I would say, as I mentioned a while ago, as long as it's medically necessary, like for example, the swab testing, we do have a coverage for that as long as it's prescribed and required by doctors. For vaccines, I'm not even sure if there is one available right now. Maybe he's talking about the flu vaccines. I'm not really sure about it. Maybe Pao, you may want to add something.
For the COVID-19 vaccine, if ever it does go to market, no, we will definitely be able to announce publicly if we will be able to cover that. But most likely, we should be able to cover that.
All right, great. So I do have a question that I would like to point to Dr. Henson. So for healthcare benefits, they play a huge role in our BPO industry. Largely what as an offering from previous that differentiated us from other industries. So we saw a slide from John's presentation on telehealth services. From your experience, can you share any other digital platforms that are available that you've seen have made it easier for everyone to seek medical help?
Right. So I was a late adopter with telemedicine, but I do teleconsults now using a platform called SiriusMD. It actually is like a full EHR, electronic medical record, with functionality for telemedicine, and that has allowed me to see patients both face to face at my clinic, but also through the computer. And early on, maybe I started using it sometime around June, I think, or late May. and it has been a pretty good experience. I'm part of a group practice of infectious disease doctors, and some of us have started using it, and we are able to see the records of each other's patients if we need to review. So I think that that has been a tremendous help for us because it allows us. There are still a lot of patients who are very concerned about going to the hospital. So this has allowed them to seek medical care.
Thanks, Dr. Henson. I do have a follow-up question to that. Well, or maybe specific to kind of the points that Dr. Cucueco had hit on the guidelines that are going to be coming out. Is there anything specific with, based on what you've seen in your practice that you feel should be something that we're implementing in the workplace in terms of sanitation?
Um, I helped out this one company with their preparations for COVID-19, and the most basic is what the assistant secretary has already mentioned. So it's really physical distancing, hand hygiene, and mask wearing. Um, if you look through policies through those three lenses, I think you'll do okay. But I do have to emphasize that hand hygiene, uh, similar to what the assistant secretary said, is not just washing your hands twice a day. In fact, um, it's actually the employers making sure that there's accessible dispensers within reach of the employee, so that they are encouraged to reach out for that product and really rub their hands with it. But again, it's true that it's a behavioral issue. Um, but I think I see now in the hospital that, or maybe it's because they're in the hospital, but um, there are many more people who are more aware that they need to wash their hands. And that's a good thing, because before the pandemic, it really was a very forgotten practice. So I think, so for example, for hand height, if you think about, say, physical distancing, and you want to keep 1 meter apart, everything in your office has to be arranged that way, from how you put visual cues in the cafeteria to the elevators, making sure that there are visual cues for maintaining physical distancing, etc. So those three things, I think, are paramount. As for the face shields, it is a good idea, and I agree with the assistant secretary that it will decrease the risk of transmission, especially when you are in public. Um, but I also agree with her that if you're alone in your office and you're really, not talking with anyone, then you can remove it, because I know how irritating it can be, and it's very warm, etc. So, uh, did I answer your question?
Yes, you
Yes,
did.
you
You
did.
did.
All right.
All
Sarah,
right.
Sarah, I don't know if I can just ask directly Dr. Hanson, because you mentioned
Absolutely.
about washing hands. I don't know
Yeah.
really if it suffices, Doc. If it's really okay, especially for us, we normally work the entire day, and it's really hard for us to wash our hands because, as the Filipino terms, it mapapasma.
Right.
So
Right.
is
So no,
alcohol can alcohol
absolutely.
suffice?
When I
Go ahead.
when I refer to hand washing, I use it interchangeably as soap and water hand washing and alcohol-based hand rub hand washing. I use it the same way. So whether it's soap and water or an alcohol-based hand rub, or even just alcohol, to me that's still hand washing. Most commonly, what you would find in offices wouldn't be sinks and soaps, right? It'll be a dispenser of alcohol, and that's enough as long as you really spread it uh, throughout your entire hand.
All right. Thank you. Okay. And also, I guess on the chat, and this can go to our Pacific Cross panelists. There was a case where one of their employees were actually at the hospital and informed that the HMO doesn't cover testing and expenses that are going to be incurred. So, in the same way that the government has no funds in helping at present day, but is this something that is covered by Philippine or for your Pacific Cross in the Philippines?
Okay. Yeah, I saw that question also, Sarah. No? So everyone's benefit by default for healthcare and medical insurance. Declared pandemics are always an exclusion. No? But in our case, in Pacific Cross, I will not speak on behalf of that HMO provider. For medical coverage, we are covering COVID availments. That's based on our current management policy. But by default, maybe that's the basis of that HMO. Declared pandemics are not covered by their health policies.
Okay.
Just to give perspective, yeah.
Yeah. Thank you for your perspective on that. All right. And again, a reminder to the participants that we actually have on today's info session. Please feel free to put any questions in our chat for the meeting today, or any of the folks want to raise your hands to ask personally and voice out your own questions. Please feel free to do so. So that we can have an even more informative session. And I'm actually going through a couple of questions that I also have on hand. Have HMOs experienced an increase or a drop in utilization during this pandemic? And do you expect the trend to continue in the foreseeable future?
Based on our experience, we saw a spike in our claims in the month of March of this year, as well as July. And moving forward, it would most likely be a hammer and dance type. So we are in that dance phase of this pandemic. So the claims trend would also follow that. And it has a direct effect. No? The CQ has a direct effect on the claims experience of HMO and insurance providers. I don't know, Dr. Carl, you might have something to add to that.
Right. Well, yes, I actually agree that we're going to be dealing with COVID-19 for quite a while. So that up and down that Paolo was talking about, that's probably going to be something that we will also experience. So we're in the second wave right now, and we haven't seen the drop in the cases. But after we get over this hump, we need to be prepared for a third and a fourth and a fifth wave. And it will be with us until we find a vaccine or some effective therapy that will immediately cure the infection. So we need to be really prepared.
Okay, and Dr. Henson, you mentioned that we're going to be dealing with this for quite a while, and I know you don't have a crystal ball on when it goes away or when we actually get that vaccine. But just in your field, have you heard any additional progress for the vaccine in particular?
So yes, so there are the Russian vaccine took us by surprise just because it came out of nowhere, and from what I've already read, there has really been very limited, at least limited available data about it. They haven't really published anything, and for doctors and scientists, that's very important. We need to know the safety data before we go into the efficacy data. So there's phase 1, phase 2, phase 3, phase 4 clinical trials, right? If you remember the dengue vaccine from before, and I'm probably treading on very, very sensitive ground here, the issue with the dengue vaccine was I think they introduced it in the middle of a phase 3 trial or something. So it was really introduced to the country very soon during phase 3. So for the Russian vaccine, there isn't even available data for phase 1 and 2. And they're planning to do a phase 3 already. So that's, to the medical societies, are very concerning. There are some ongoing clinical trials for, I know, about 2 or 3 vaccines in the United States and in Europe. And there's preliminary data that they are performing very well, but phase 3 trials are notoriously very long. Because we need to make sure that the vaccines are both safe and effective. So I think we're looking at the earliest possibly that vaccines can be introduced might be late this year or early next year.
All right, and that's that's, I guess the thing that we're hearing, and appreciate your thoughts on that. There are I'll move into my last question, and it'll be for you, Dr. Henson. But there is something on our chat, and asking about your thoughts on dexamethasone,
Right.
as medicine used as a cure, and just to that, what other supplemental vaccines do you think are actually helping us right now? Is it like the flu or the one for pneumonia? And I guess that's just the other follow up that I had for that particular medicine.
All right. So dexamethasone has been shown in a study in the United Kingdom that it works well to prevent progression of COVID-19. But there are several caveats. It cannot be given very early. It has to be given to someone who's already requiring oxygen and someone who's mechanically ventilated in the hospital. So the data actually show that if it's given very early, there's actually a worse outcome for the patient. There has to be some form of inflammation that's ongoing in the lungs for it to work. Otherwise, then it's gonna be a bad medicine for patients. So it cannot be purchased from Mercury Drug, and because you're worried about COVID-19. It has to be given by a doctor to a COVID-19 patient who actually requires oxygen. The other drug is actually remdesivir, and there's also good data about that. Again, it is a drug that's for patients who require oxygen. Um, so those are for the relatively sicker ones. So it's not as useful for most of the patients who do well on just home isolation. You asked about vaccines, and this is something that's really close to my heart, because it's preventive. Flu vaccines, it's an absolute must for everyone at this time because you don't want to get flu and COVID at the same time. But flu does nothing, influenza vaccine does nothing for COVID-19. What it does is prevent you from getting influenza, another viral infection. And if you don't get influenza and you do get COVID-19, then you have a much better chance of making it, rather than having two infections at the same time. The other vaccine that we also recommend for some specific age groups, I believe it's about 50 years and above, will be the pneumonia vaccines. We start with a vaccine called PCV, or conjugate vaccine, first, and then followed a year later by PPSV, like subcap. It escapes me at the moment. PPSV 23 a year later. So it's a series. It's not an and or. So you have to ask your doctor about what should come first. But definitely for patients who are 50 years and above, or if you have an underlying condition like diabetes or HIV, you can get a pneumonia vaccine as well.
Thanks, Dr. Henson. Okay, so that actually wraps up our Q&A, thank you for helping make this such a it's such a great dialogue and even more informative session for our members. And thank you to our speakers, our panelists, for your time and your insight, and for our members who actually sent in their questions. So to close us out, I will pass it over to Roger for our closing remarks.
Thank you, Sarah. I just want to thank everyone for today's session, for being here. Special thanks to our speakers, Dr. Carl, John. Thank you. I also want to thank our panelists, ASEC, Dr. Ates, who's not with us, and John as well, for helping capsulize, put things together, help us understand a little bit. I think it was a good session to learn more, because as many of us in the healthcare industry, we have HMO plans with our different, for our people and all, but I guess sometimes it's in the fine print, right? And that's where the details differ, and oftentimes we we see that's where we can the differentiation really lies. And for us to prepare for anything that, I mean, beginning of the year we had Taal volcano, and it was considered an act of God, and people couldn't get insurance, right? Whether it's for health insurance or even for their homes, for the repairs and all that, because it was an act of God. Um, Here we have a pandemic situation, and to your point earlier, John, you were saying. Some plans have it, some plans don't have it, and maybe that's where I think the need to really look and see if there are any very specific products that can really help our members. So thankful, thankful for today's conversation. Thankful for the discussion today. Sarah, thank you for moderating the session. Gail, thanks for opening remarks, and also thanks to Jenny of Optum for getting ASEC, Dr. Cucueco, to participate in today's session with us. So on that note, we can close this session. We'll have more. We'll have another session, I think, in a couple of weeks, and would like to encourage more of our members to join and participate. So on that note, I just want to say thank you to each and everyone. Please keep safe. Have a great weekend, and thankful to all.
Thank
Okay.
you.
Thank you.
Happy weekend.
Thank you.
Thank you.